Good morning, Valley students, and welcome to week number 2 of ethics. And I wanted to just spend a little time with you this week, kind of going over in general studies, in general ways, the things that we'll be looking at during the days of this week. And this is we really get down from the foundational truths that we talked about last week about ethics in general to more specific things where probably most of us have quite strong opinions. And so we'll talk about those today just briefly, and then you'll be reading about them in your text and interacting with them in your week's work, which I think will leave you with a good understanding of where these issues are. One of the first issues that comes up in chapter number 10 is the question of euthanasia, or more commonly and often called mercy killing, or allowing someone to die. And I want to take just a moment to think about the ramifications of that. We have gone through, and you have maybe missed it because you are quite a bit younger than I am, but we lived through a period in the 70s and 80s and maybe early 90s where it was called physician assisted suicide, where a person has the perfect right to determine how and when they will die. And of course, we know that suicide is the taking of your own life, and that happens in many cases today and many different reasons. And so we'll not spend a lot of time with suicide and about what you feel with that, but legal assisted suicide is a whole different ball game in which the physician prescribes medications that you can take to kill yourself. Usually it's caused by people, or it's usually it's utilized by people who have extensive pain. Maybe they have a debilitating disease. Maybe they are terminal and they don't want to face all the pain and the agony that goes along with the end route that they are facing. And so physician assisted suicide is now much more acceptable than it was in the 70s. It was a bigger legal issue. One of the things you will realize in talking about ethics is that the more common something is in our society, the more our ethical positions as a society, not as an individual, but as a society, will tend to change with that. And we've seen that, and we'll talk a little bit about the death penalty at the end. But death penalty used to be widely accepted in our society as a means for punishing the most hardened criminals. That has changed today, into which the death penalty is much more dubious and debated than it is. Abortion would be another issue, and we'll talk about that also in a moment. But abortion, when it was first determined to be unconstitutional, to deny a woman the right to determine things about her own body, in those days, abortion was a hot issue. It is still considered a hot issue today, but that's the area that I do most of my research and writing on. My expertise is American religious history, and especially the fundamentalist evangelical movement of today. And they use abortion today and as a way to raise funds and get people involved. But I question whether they really are against abortion or not. They make very little effort to get it overturned if they are, but it's always in the discussion. So that's one of those that is definitely in flux. And sexual morality is another one. You might still have strong ethical feelings about that, but lots of things change that in our society, from television, constant exposure to a lot of things that will, with time, people begin to accept as just normal practice and not something to get all fired up about. Equality and discrimination are others, and economic justice, all those things are ethical positions that we all talk about and that we have and that we hold. And so we're getting down in this chapters to the very meat of what we think of as a person. Remember, we said last week that ethics is a very personal issue. It's something that we hold very dearly personally, and then we will, do battle over that sometimes in the marketplace, or arguing with your husband or wife or whatever. But ethics are the very basics of what we believe and what we hold dear. So let's talk about euthanasia for a moment. And euthanasia is the practice of mercy killing or physician assisted suicide, or allowing someone to die because they are not going to get better. And so that is one of the big deals that we probably are facing today more than any other because of the COVID-19 pandemic that is wreaking havoc in the world today. And the doctors have said, and they said at the beginning, that it might get to the point to where they have to make decisions about who they treat and who they don't treat, because they are literally overflowing with cases, and they have to make the best choices for the best outcomes. And we thought, man, that's tough. I mean, I don't want my relative to be one of those that has to be determined not to be treated. But my friend, we have reached the point to where that is exactly what is having to be done. On this day, on Wednesday, December the 9th, 2020, our hospitals are overrun with COVID patients and people that are dying. And so their doctors every day are having to make end of life issues decisions so they can treat the ones that have the most promising effect to getting better. And sadly, that is what's happened with this pandemic that we live in. So one of the things that we talk about with euthanasia are advanced directives. And that's something that you as a human being should be thinking about. You should have it all documented how you would like to die. I know we don't like to think about that. We want to think about living, but far too many people wait until it's too late to do anything about advanced directives. But you should have a living will, which directs the doctors in how to take care of you. Say you were incapacitated and you're on a ventilator and all these other things that you have no way to make a decision. You should make that decision in advance and have paperwork documenting that with you and within reach of those that are taking care of you, because that is just a very important way to have your wishes known. Your family, if they have to make that decision, will often make it based upon guilt and a lot of other things, or trying to keep you here. And the question is, do you really want to be kept alive on a machine when you don't have any quality of life? So those are issues that we all kind of face. Euthanasia is a word that usually designates a good death. What is the best way that you can exit without a lot of suffering and pain and expense and all the other things that go into that? Now, I've been a pastor for 20 years, a lot longer actually, but I've actually been in the pastorate 20 of those years. And I have stood beside many a bed in a hospital with a family. And I realize, and you may not realize, that death is not the worst thing that can happen to people. I've seen it where they lived in prolonged agony or years on a ventilator, years on machines. We have reached the point in our technology when we are able to keep people alive on a machine almost indefinitely. And the question is the quality of life, whether that person really wants that or not. We see that often in newborns that are born prematurely. We do have machinery now that can help them finish out the term and get them more mature before they have to go out and meet the world. That's not a bad thing, but usually euthanasia for infants is a very hard choice, just like it is for our elderly. There are no good choices, and that's why I maintain that you taking that choice as an older person away from those who would have to make it otherwise is probably one of the best things that you can do for them. The question that arises in this discussion is, how do we determine when a person is dead? I'm a historian as well, and as you go back and look at history, you will find all kinds of interesting things that people have done in the past because they had no real way of knowing when a person was dead. They didn't move, they're not breathing. The reality is that your body can shut down to the point that you are barely breathing and maybe not even enough to move a feather. And that used to be the test they used to check to see if a person was breathing, is they held a feather under their nose to see if it moved. Sadly, as a result of that, there were people in comas that got buried, and all kind of frightful stories go on with that. In the 1800s, there's this giant mass fear that you're going to be buried alive, and so they came up with this idea. Well, we will tie a rope around the big toe of the person being buried, and if they were to come to in the grave, we'd tie that rope and bring it out of the grave to a bell, and that bell would ring, and we'd hire night watchmen and dig them up and get them out of the grave before they suffocated. Well, such terms as night watchman, graveyard shift, saved by the bell, all those English terms come out of that very crazy period of our history when we were afraid of dying. Today, the definition for death is tied to brain activity, not to breathing and not even sometimes to your heart working, but to whether you have brain activity or not. There are people that are in persistent vegetative states in which they are just eating and breathing, or food's being worked in and out of them, and air in and out of them. But there are all kinds of different states that we have to deal with. But when we look at whole brain death and the understanding that you're not coming back to any kind of level of living, then that usually is where we consider a person to have died. There's all kinds of different terms for euthanasia. You can look at those in your book and gain some greater understanding of them. Physicians in several states now are able to prescribe drugs and help a person, if the state allows it, to exit quietly. There are also, they give you pain medication, palliative care when you're terminally ill, which will allow you to be pain-free, but just let natural forces take their path. And so euthanasia is a very interesting subject, something that you need to spend a little time in reading about in our textbook this week, that I think will be very helpful to you. We're also doing a case study based upon that. The second thing I want to just mention in passing is abortion. Abortion is as I said, a very hot issue, especially among religious people, about where life begins, whether it begins at conception, when the egg fertilizes the sperm fertilizes the egg or not. At that point, is that life, or is it when that fertilized zygote attaches itself to the uterine wall and the process of cell division begins? Is that life? Or is it life when that baby is born and expelled into the outside world? Those are the big issues with abortion that people argue. Roe versus Wade was the famous case in 1973 in which it was determined that a woman had the right to have an abortion and had control over her body. We've been in a fight over that ever since. If you noticed Mr. Trump's latest nomination to the Supreme Court, that was a big issue because she was anti-abortion. And so the more progressives and the more liberals had a problem with that, and more conservatives had wanted her on the case. And so that is a big, big termination. We've now had legalized abortion since 1973, which is about 50 years, and it's not been reversed. It has become settled law. And the question is, can something that has become settled law, can it be reversed, or should it be reversed and go in the other direction? So the law business has been something of great concern. So we look on one side at the moral status of the fetus. The other determination is the health of the mother. If you have, is it permissible to kill the baby or to terminate the baby in order to save the mother's life? Those are all issues that come up under abortion. And then, what does it mean to be human? I mean, we often, sometimes at one side of the fence, we'll talk about, that we're a part of the animal kingdom and that we have the genetics for that. And then we talk on the other side of the fence about human beings and how special they are and how different they are, to continue to move these arguments forward. So abortion is something, as I've said, that's quite an interesting consideration. So where does your ethical foundation lie in that? If you are on one side of the fence, you are pro-abortion, anti-abortion. There's a lot of people in the middle. If you're in euthanasia, mercy killing, if you're working in the healthcare industry, you're seeing probably much more of that today than you have ever seen in your past. I'm not going to say a whole lot about sexual morality, but that is also another ethical position that is widely divergent and different today among people. We live in a very permissive society. And interestingly enough, the United States is probably the only people in the world that categorize, or what I call pigeonhole, all these different kinds of sexuality. We have homosexual, heterosexual, pansexual now. The LGBTQIA moniker is lesbian, queer, all those things, all those letters have a mean. Transsexuals are a big discussion point today. And we say, where did all that come from? It's always been here. But we just now realize that the numbers, as people become much more open about talking about sexuality, we remember that many more people are involved in those issues. And so there are people on one side of the fence that believe this is learned behavior. There are others on the other side of the fence that believe it's genetic. Having been trained in science and religion, I come down on the side of scientific. I believe that being homosexual or having any of these other monikers attached to your feelings about your sexuality, number one, is your business. It's not mine to judge and to criticize. Number two, I believe that it is genetic. I don't think anyone in their right minds would choose to be abused the way most people in those categories get abused in our society today. But there again, that goes to my ethic, and that may not be yours. You may not agree with that, but that's pretty much how we kind of parse those things out. Another area of great importance is equality and discrimination. I feel very strongly about that. To be perfectly honest with you, I was a pastor for 20 years. My last church, when I resigned, I said at that point that I would not join, nor would I pastor another church that discriminated against people of other races. To be honest, I was a Baptist pastor, and the most segregated place on the face of the earth is the average Baptist church on Sunday morning. And I would not join another church that did not allow women into their leadership, because I think those are discriminating things. Just like we discriminate against homosexuals or anybody else, we should not be a discriminating people. And Christians especially should not be discriminating. And I have lived by that. But to have a society that's free of discrimination, I think in recent days that we have gone backwards in that. I think we have lost ground. I lived through the 60s and the 70s and the great battles over discrimination with civil rights. And we had hoped that in those 50 or 60 years since then that we had made some progress. It seems like in the last 4 years, we have pulled the bandages off of every scab and opened every wound and gone back to where we were in the 50s and 60s on the issues of race and women and sexuality and every other thing. And so some of that now is just my opinion. It's my ethic. You don't have to buy into that. You have your own, but be able to defend it. Whatever your ethical position is, don't just adopt it because I said so, or because some pastor said so, or some candidate for president said so. Have your own ethic that is yours, that you defend. And if you can defend it from the Bible, or you defend it from your life, or from your grandma's teachings, or whatever it is, ethics is some position that you have that you should defend. And then quietly go about your daily duties, living in the world, realizing the person that you work with may have a different ethic. You may feel differently about abortion, but it does not engender you arguing over abortion or arguing over civil rights. Be human and treat each other with the same respect. Do unto others like you would want them to do to you. The golden rule is a great thing to think about. And then there's also economic justice. It's a big issue in this country that we have so many people today that are hungry, that are without food and clothing and a warm place to live. And yet we spend millions and millions of dollars on military and on everything else, and our children struggle to go to school to get ahead economically. We should have some feelings about that. It should upset us that not everybody in this country has what they need to live. So in general, those are the things you'll be thinking about this week. I just wanted to kind of whet your appetite and help you to understand that there's a lot of things to learn in this, a lot of important things that we think about. Ethics is one of the more helpful courses to us as we work and live and move every day and go about our business. But remember, you don't have to have my ethic, and I don't have to have yours. But whatever you have, defend it and be able to be at peace with it. You don't have to go out and do war every day with everybody that disagrees with you. And I think that's a good place to leave it. Okay, we'll see you next week on Lecture 3. Thank you.